dental implants. Safe ba ito? Masakit ba ito? Sino ang pwedeng lagyan? You have to watch this video, tune in, and don't tune out. Hi guys! I'm Dr. Kanesha Tingson. I'm a general dentist with special training in oral surgery and dental implants. And thank you very much for subscribing to this channel. And please click the bell button so manonotify kayo kapag may mga new videos na ilalabas. Today, we're gonna talk about dental implants and ano ang mga most common questions people ask during dental implant consultations. Okay, number 1. What is a dental implant? A dental implant is a replacement for natural tooth, which means gumagawa tayo ng kapalit ng mga ngipin na nabunot. Ito yon. Yan. It is screwed to the bone and its foundation is the bone. Okay? It is the most conservative option, especially for those people na ayaw na nilang galawin yung mga iba nilang ngipin because it doesn't require removal of tooth structure. And ayaw nila ng mga nare-remove na option katulad ng mga dentures. Okay, what is the upside and downside of dental implants? Of course, pinaka-obvious na upside niya is its conservative approach to restorative dentistry, which means i-restore mo yung nawala at wala kang ibang gagalawin. Katulad na to, a dental implant, it does not require removal of enamel in order to replace what is missing. Katulad nung kung maglalagay ng bridge. Ayan. Ayan. Okay. So, ang pinaka-downside lang of its price. Kasi it's different, yung price range na it's different from, of course, yung dentures na removable option and yung mga bridge na non-removable or also a fixed option. Pero kapag i-compute mo yung long-term effect niya and yung long-term gastos, of course, mas magiging sulit if dental implants. Pero, syempre, depende pa rin sa case-to-case basis. There are single missing tooth, there are or also sometimes multiple missing tooth na mas magandang option yung denture. Okay, are dental implants safe? Yes, dental implants are safe kasi it is biocompatible. It is highly biocompatible because it's made up of titanium na yung ginagamit kapag nababalian ng bone, tapos naglalagay ng screw in order to attach them both together. Yun yung ginagamit, kaya hindi siya nare-reject ng katawan. And who are good candidates for dental implants? Good candidates for dental implants ay if ikaw ay hindi ka medically compromised, meaning wala kang other medical conditions such as diabetes mellitus, vitamin D deficiency, or any kind of liver and kidney dysfunction. Good candidate ka rin if you are not a smoker. Also, good candidate ka if you have a very good and you have proper oral hygiene and you're willing to listen to the dentist na i-maintain mo yung oral hygiene dun sa dental implant area. Okay. Number 5. Can dental implants be done in one day? Yes, dental implants can be done in one day, pero it is only a temporary crown. So, yes, a dental implant can be put actually same day sometimes with tooth extraction. Pero yung crown na ilalagay, it's just temporary. And it's allowed to osseointegrate for a few months before lagyan ng permanent restoration. Pero sometimes, if stable yung implants during surgery or if maganda naman yung bone support, pwede na lagyan agad ng permanent na crown. Okay. Number 6. How long does the dental implant procedure take? Yung dental implant procedure, it only takes, if it's a simple procedure like one tooth and with enough bone, it can only take 10 minutes. 5 minutes for anesthetization and 10 minutes for the surgery. Siguro more or less 5 to 15 minutes kasi meron pang suture and meron pang... Anyway, medyo technical lang. So yun. How painful is getting a dental implant? Actually, it's a case-to-case basis. Pero during surgery, dapat, syempre, ang role namin as dentist ay walang ma-feel during surgery. So, dapat wala talagang mararamdaman. And as reported by my patients, wala naman din silang extreme pain na naramdaman after surgery. Maybe meron sigurong discomfort, pero not something that cannot be controlled by pain medications. So, for those cases na medyo maraming dental implants, multiple dental implants, syempre, may-expect natin na mas medyo mataas yung discomfort doon. Pero not something na, you cannot take. Can your body reject a dental implant? Yes, pero for a very, very narrow percentage lang. Merong mga reported cases, pero wala pa sa experience ko. Rejection sometimes means failure. Yung failure ng dental implant can be caused by a lot of factors such as patient-related, medically compromised patients, o kaya yung bad oral hygiene. Also, it also depends on the dentist's capacity to do the surgery or his or her experience. So yun, pinaplan namin siya lahat bago siya gawin para hindi manarrow further yung chance of rejection or failure. Ayun. How long do dental implants last? Dental implants should last as long as you live. That is why we have a exclusion criteria. We choose the cases properly because we want to make sure na magsusurvive lahat ng ilalagay namin sa'yo. For example, syempre, sayang naman yung ginagastos mo. So, ayun. Next is, are dental implants common? Dental implants, yes and no. It is common in advanced countries kasi that's their option eh. Kasi, they are the proprietors for bridges, dentures, and everything. They have experienced yung mga disadvantages ng other options. That is why they invented dental implants to compensate for all the disadvantages of the old procedures or old options such as dentures and bridge. Yan. Hindi siya common sa mga provinces such as here in Laguna, in Binyan, in San Pedro. It's not acceptable dito sa area namin. Kasi sometimes patients would feel freaked out by something na merong some foreign body dun sa jaw nila. Yun yung nafe-feel nila. What can I eat after dental implant surgery? Kahit anong pwede mong kainin except ay mga hot food, and you cannot drink hot beverage as well. Also yung mga nutty, tsaka yung mga hard, kasi it can disturb the healing area dun sa surgical site na ginawan. Anything that can dislodge the blood clot or that can disturb the healing is to be avoided. How soon after a tooth extraction can you have a dental implant? You can have it as soon as ma-extract yung tooth para isang surgery, isang sakitan, isang injection and everything. But it has to be properly assessed by the dentist kasi syempre, halimbawa maglalagay ka ng screw, dapat merong foundation. Kung walang bone, such as sometimes na nakain na nung dental infection, hindi magiging stable yung dental implants. Also, we also assess if there is presence of acute infection around the area kasi it can cause failure of dental implants. Sometimes we assess via CBC o kaya then in order for us to check for the availability of the bone, we also require 3D CBCT or 3D scans. CBCT kapag ang term used for CT scans sa dental. So how long does it take for dental implants to heal? It will take 6 months to fully integrate with the bone. Okay. Once you put the dental implants in the bone, it is not yet accepted by the body. It takes 6 months so that the cells from your bone would habitate yung surfaces ng dental implants. Yun. Once it is accepted by the body and once the bone cells habitate yung surfaces ng implant, sobrang tibay niya na, like, parang nakadikit na siya sa bone mo, hindi na siya matatanggal. What can you not do after dental implants? Of course, you cannot participate in heavy strenuous physical activities because it can increase the blood pressure and hence dislodge the blood clot. Meaning, kapag masyado ka nagpagod or nagbuhat ng mga mabibigat at kung ano-ano yung kung nag-rupture yung mga newly formed blood vessels, eh, didudugo siya. Yan, you cannot spit strongly then because it's a negative pressure. You cannot drink sa straw because it's a negative pressure as well. It can dislodge the healing processes going on around in the area. And also, no, I almost forgot, bawal yung smoking after dental implants. Yun, bawal talaga. And then, can you remove dental implants or do they stay in your mouth? Okay, that's a very good question kasi people are curious, diba? So, that's why may dental implants is para so that you will experience the new tooth again. Kasi it's a hassle to use something na removable. Some people will accept that more than undergoing surgery. I respect that. Okay lang yun kasi iba-iba naman yung mga tao. Ayun. So, kaya yun yung choice mo kasi para hindi siya ma-remove. Etong crown, may mga components ang dental implants. Etong screw, etong abutment na nilalagay sa taas in order for it to hold the crown, and then the crown itself. Ayan. The crown can be removed for hygiene purposes or it can be removed lang sometimes if hindi na screw ng maayos, and it can be put back here. But once it is fully integrated with the bone, this dental implant, it cannot be removed. It will stay there as long as it's there, as long as you're alive. Anyway, can you turn dentures into implants? Yes. For those cases who do not have bone after tooth extraction, di ba? Kapag nagumutan na, di ba? Tapos, it took 20 years or 30 years for you to decide na, I want a more permanent option. Sometimes yung bone, it resorbs. Para siyang kumukuyos, ganun. And then, yung dentures na, hindi na kumakapit yung dentures kasi wala nang kakapitan. So, loose na siya. Hassle na para kay lolo or para kay lola, ganyan. Nasuotin siya. Kaya, sometimes yung dentures, it is incorporated with dental implants. Nagiging parang nagiging ano na siya, lock. Na siya yung dental implants. It becomes like a button for where the dentures will be held. Ayan. So, ang tawag doon, implant retained dentures and implant supported bridge. Pwede rin yun. So, does food get under dental implants? Yes and no. For single implants, hindi dapat kasi meron dapat siyang proper emergence profile, smooth, ganyan. So, it's self-cleansing or it is cleansable by itself. Kapag ipa-floss mo, okay lang, pero it should not get underneath this. Or else yun yung mga dental implants na sometimes malposition, for some reason, di natin alam. So, for dental implants na multiple dental implants and incorporated with a fixed bridge, yes, food can get under it, pero the design is made such that it can be cleansable for the patient. It is smooth, it is may space sa likod wherein the floss can pass through. So, yun lang. Okay, thank you very much for listening. If you're at the end of this video, salamat ng marami for listening. Alam ko medyo boring to. Pero I hope I added value to your day and I hope I clarified some misconceptions or some notions about dental implants. And I hope I shed some light dun sa mga curiosities niyo. And if you think this video is shareable, you can share it to the people who you think you need this information. Thank you very much. Please click the like button so medyo ma-encourage ako gumawa ng videos. And click the bell button again para certified kayo.